learned that you're going to need surgery, orthopedic surgery. Now you're trying to figure out, how do I decide who I want my surgeon to be? The first thing that you need to think about is, how do you feel about the surgeon who just told you you should consider having surgery? If that feels like it's a good fit with that surgeon, that's an important sign. Always trust your gut. Always trust your gut. If something doesn't feel right, you should get a second opinion. And don't be afraid to tell the surgeon, you know what? Thank you. I think I'm going to get a second opinion. Yes, we are egotistical orthopedic surgeons, and we do feel, but you know what? It's a big decision. And if you're not comfortable saying that, don't say it. Just say thank you very much, and go ahead and say you'll think about it, and then get a second opinion. But you definitely have to feel like you like the surgeon, and much more importantly, feel like you can trust the surgeon. Remember, that surgeon may play a role in who the anesthesiologist is. You have to worry, honestly, a little less about the surgeon, but more about the anesthesia that's provided at that facility. Because that anesthesia doctor is putting you under anesthesia. And the number one thing you're worried about when you're thinking about surgery is, will I wake up after I have my anesthesia? That's very, very important. And that's what patients are worried about. My patients, I mean, I'm in practice a long time. So, with my reputation, thankfully, most patients that see me, they're not really that worried about me, but they are concerned about anesthesia. So I have a surgery center in Midtown Manhattan that I part own. And what I make clear to them, now that I've learned how much they're worried about anesthesia, is to say, listen, you don't have to worry about this surgery center that I help run. My wife has been under anesthesia, my father, and multiple family members. So they're the best in the world, which they are. So these are the kinds of things you want to be able to understand and ask, and never be afraid to ask questions. If the surgeon doesn't like that you asked it, you need to get another opinion. Reputation of the surgeon. And reputation means, does the surgeon have a reputation of being honest? Honest means doesn't operate on everyone, doesn't not operate on anyone. You don't want your surgeon to be too conservative. You don't want your surgeon to be too aggressive. It depends on the case. You want them to be able to make that decision based on experience and what they think is best for you. I've had patients where the MRI scan is markedly positive and they come in assuming they need surgery, and they don't, because we don't treat the MRI scan. So if the MRI scan's positive, that doesn't mean we got to go to the OR. So when you get that MRI scan that looks positive and you get worried, wait, make sure you find out what the surgeon says. On the other hand, there will be MRI scans that are negative, and they're good quality scans, but I'll disagree because I examine the patient. Remember, when there's an MRI scan being done, the radiologist who reads it and tells you the diagnosis, they don't examine you. They don't have the experience of whether or not you need surgery. That decision is made alone by the orthopedic surgeon. Another very important factor that you should use in order to choose your surgeon is reviews. That's a whole big story. I mean, I'm sure you're familiar with reviews when you're looking for a restaurant or when you're looking to buy a product. It's similar with surgeons, and it's different. So, first of all, it's nice to have someone where, if you go to Google, for example, to get the reviews, you want a lot of reviews. If the person has only 5 or 6, that's not really very powerful. When they have 50 or even 20, that's good. And the more reviews they have, the better, because it's a better understanding of how good that surgeon is. The other thing about it is, though, most people are not going to go out of their way to do reviews unless they're really happy with you or really upset. And then the question is, why are they really upset? Sadly, the reviews, many of the ones that I've gotten over many, many years that weren't really great, it wasn't so much just my relationship, it was different factors. So you can't please everyone all the time. We strive to do the best we can. I would say with your surgeon, if 8 or 9 out of 10 will give you, of those reviews will be very positive. That's pretty great. So 4.5, which is essentially 9 out of 10, 4.5 out of 5, that's great. But you need to have enough reviews for the surgeon in order to understand. And feel free to read the reviews, but take it with a grain of salt. It's not, it's not everything, but it's very helpful. Location of surgery, that's important. Is it in a hospital or is it in an ambulatory surgery center? And if it's in a hospital, how's the hospital, right? Reviews for the hospital is important. Ask around where it is. I'm biased, but I feel like the hospitals in Manhattan are outstanding. No place is perfect. We prefer to do our surgical procedures in an ambulatory surgery center when we can. And the reviews for the ambulatory surgery center are important. I would say that if your surgeon tells you he does surgery in a hospital when it's a surgery that can be done in an ambulatory surgery center, it's important to ask why. Because on average, a simple orthopedic procedure, meaning a surgery where the patient can go home the same day, which is also called ambulatory surgery, should be done in an ambulatory surgery center because the success rates are higher, the infection and complication rates are usually much lower, and it's just better, more efficient too. I'd say I do about 98% of my surgeries in an ambulatory surgery center. And some even big spine surgeries are being done in my surgery center in the city. Total knee replacements we're doing in our surgery center, total hip replacements that oftentimes in other places around the country are done in a hospital setting. Obviously, the patient has to be safe enough for that to be done, but you want an ambulatory surgery center that's so cutting edge that it can do these things. Another aspect of what you should think about when you decide about a surgeon is his or her credentials. If you can learn that, which you usually can through the web, what medical school, what orthopedic surgery residency training, whether or not he or she did a fellowship, how many years in practice, where is it practice? Is it, do they work in an academic medical center where they work for the hospital? Or are they in private practice where they don't do any teaching at all? Or in our case, it's a combination. Instead of academic or private practice, I like to call what we do privatemic. So we're in private practice so that we can give that private practice feel, but we also train and teach and stay cutting edge and have residents occasionally, fellows, students watching, and that keeps us sharp. How's that?
So we don't really want to talk about medical publications or presenting in conferences. Does it make sense to talk about it or not really?
No. No, because
Okay,
patients, okay, so you could, well, if we do, it could get a little dicey though, where if
got
I'm
it.
going to give the pluses of someone teaching at conferences, I'm also
Yeah,
going to give the negatives of
right,
most of the time when they do a lot of teaching, that means they're not that great in the OR.
Mhm.
It's just how it is, Rand. You have
right.
some
Yeah,
that are
I
outstanding in
believe
the OR.
you. I believe you.
There's no
I believe
question.
you.
Well,
Yeah.
I'll tell you what we can also do.
And what
We
about
can
Okay.
also
technology?
discuss the pros, excuse me. We should also discuss the pros and cons of
Okay.
choosing a surgeon at a major academic medical center. What are the pros and cons? Pros
Okay.
are it's very often as cutting edge as you can get because everyone's looking at the cutting edge material. However,
Mhm.
there are residents that are being trained. And as a result, the patient does have to be aware of the fact that,
Wait. Let's record it.
sure.
Let's record
Okay, sure.
it.
Good
Okay.
idea. Shall we?
Yep.
So, how do we decide whether or not we want to choose an orthopedic surgeon that is employed at an academic medical center and works as academic faculty for that academic medical center, or someone who's in private practice? When choosing a surgeon who works in an academic medical center, there are a lot of pros, which are that orthopedic surgeon is almost always on the cutting edge of orthopedic technology, access to the best instrumentation, constantly learning more and more cutting edge material, and at some point, sometimes teaching themselves, which puts them in a strong position where it demonstrates that they know what they're doing. It does not imply that the surgical skill is good or bad, outstanding or poor. The expectation is that it is at least average, and that's fair, and that's good. One of the potential cons of working in an academic medical center is that the patient is not aware of exactly how much of the surgery is being done by the surgical attending versus the training doctor. Academic medical centers train residents and fellows, and that's fine. That's a good thing. It is important, however, for that patient to be aware and not afraid and be able to ask the proper questions. For example, are you doing the case, doctor? Or are you committed to doing as little of the case as possible where your resident or fellow is doing the case? The best answer for that would be we do the case together and I allow the resident or the fellow to do whatever I think they're ready to do. And the question can be, are you always in the room? And the answer should always be, of course I am. So that's one thing. Another is the anesthesia. There are anesthesia residents who are being trained as well. So it's important to make sure that the patient is comfortable with the fact that anesthesia is undergoing training. So the better the quality of academic medical center, the safer it's going to be, the less complications there are. So when deciding about an academic medical center, I always highly recommend that it's considered one of the best in the country, if possible. And in my area, we've got a lot of places like that. With private practice, the pros are that it's more of a hometown feel. It's not as unionized. It's not as large. And so some people prefer that smaller feel, especially solo practice, which is uncommon. And so that's nice. People like that. They enjoy that kind of feel that is given in a smaller private practice opposed to a large hospital setting. The cons are that some of those private practice orthopedic surgeons have nobody watching. They're not teaching anyone. They are not necessarily staying sharp and on the cutting edge, which is also fine because we do, in order to be board certified, take exams every 10 years to make sure we're board certified. But it's possible that the techniques that surgeon is using may not be up to date, or they may not be as sharp. The best timing for how many years you want your surgeon to be in practice varies depending on the case. It depends on the surgeon. So all these things are great factors that one can use, and there's no right or wrong. There's no best. Like I've said, the most important thing is how do you feel about that surgeon after you've met with him or her?